Hello everybody, my name is Ollie. I am a doctor living and working in the UK as part of the NHS. Welcome back to my YouTube channel. And as I promised in my last video when I was giving an explainer as to why doctors in England are on strike at the moment, I said I would follow it up with a video about the phrase junior doctor and why it might not be that helpful and really why it needs to go. And that starts with me. Hands up, as you will know, when I qualified almost 2 years ago now, I started introducing myself as a junior doctor. From here on out, it's simply going to be doctor, and this video is going to go into why. And the reason that I defaulted to introducing myself as a junior doctor is that there is a certain amount of historicity and culture that goes along with that phrase, and instinctively we always assumed that people would understand what it means. But actually, when it comes down to it, do they understand what it means, the general public, patients that we're looking after? Probably not. And collectively, recently doctors have been doing a huge amount of thinking about this because of the massive amount of attention that's been placed on the role because of the ongoing strikes and industrial action. Specifically, there's been a huge amount of discourse and commentary, both in the friendly and unfriendly press and on message boards and social media sites everywhere, about the work that doctors do. And for the rest of this video, I'm going to set out several reasons, basically, why I think the phrase is unhelpful, on much reflection, and why we should probably stop using it. The first, and perhaps most obvious, is that the phrase junior implies somebody who is inexperienced or unskilled. And to start really simply, as one thing that can be avoided, when many people, I'm not saying everyone, but a certain number of people hear the phrase junior doctor, they confuse that with medical student or student doctor, someone who is still at university studying their medical degree and is not yet a qualified doctor, or even worse, that you're some sort of apprentice. Now, the major issue with this is that by the time a doctor qualifies, finishes university and becomes a foundation doctor and starts working in a hospital as a newly qualified doctor, they are appropriately qualified for the working role of a doctor that they move into. Now, of course, a doctor in their first day or throughout their first year will probably know less and have less experience than perhaps other types of doctor, especially more senior doctors. But that's the point. That's when you are qualified, and that's when your postgraduate training begins. And you will go on and continue to build more experience and qualifications, whether that is Royal College membership, exams, courses, whatever. But I don't think that we should either tolerate or perpetuate this idea that even new doctors are unqualified. They are exactly qualified for the role that they are doing at that time, otherwise they wouldn't be there. And then revisiting the idea of apprenticeships specifically in comparison to apprentice models. While it obviously is true that in their postgraduate training, particularly in their specialty training, doctors learn according to an apprenticeship model, especially in disciplines like surgery, where it really is about that one-on-one ongoing relationship with a senior doctor who is teaching the newer doctor the basics of the craft. This is not similar at all to how other models of apprenticeship work in the UK. And the comparison really does a disservice to doctors who are training for a very, very, very long time. And the phrase junior doctor, as we all know, unhelpfully encompasses everyone from that newly qualified doctor on their first day of practice, all the way through to the most senior of registrars and specialty trainees who might have decades of experience, who are not yet consultants. The phrase is so broad and all-encompassing that it doesn't really tell you anything about a given junior doctor, who they might be. And secondly, the term junior doctor doesn't really capture the complexity and responsibility that comes with the role. It in fact implies that they don't really exist, because many junior doctors are responsible for managing complex medical conditions, making life-saving decisions and providing critical care to patients. They work very long hours in very challenging conditions, and you simply cannot run a medical team without these doctors. Just look at the phenomenal impact that the 3-day strike had on appointments, and then look at what's been cancelled preemptively for the upcoming strikes next week. When we're thinking about junior doctors, it really is a case of Schrodinger's junior doctors, where we are both sort of too green, incompetent and newly qualified to pay properly, but at the same time we're then so valuable that the entire service seems to collapse as soon as those junior doctors are removed. A junior doctor is still going to be the one seeing acutely unwell patients, reporting scans, performing life-saving surgery, doing whatever you need doctors to do, so why not just call them doctors? And then thirdly and lastly, I wanted to think about this from a patient-centric perspective. Would dropping the use of the phrase junior doctors ultimately change anything for patients? And to break away for just 1 second, I do think that role introductions are really important, as is the use of proper titles. I get extremely worried, as do a lot of us, when you hear about non-doctor healthcare professionals either introducing themselves as doctors when they're not, in order to take advantage of the trust and the historicity of the profession that comes with the use of that title, or does the opposite and deliberately obfuscates their title and will say something vague like, I am a member of the medical or surgical team, that doesn't really tell the patient anything about who they are. It is really, really important that healthcare professionals are completely truthful when they're introducing themselves to patients. So historically, have I introduced myself on the ward as a junior doctor to patients? Yes, I have. But then I was thinking, well, would a registrar introduce themselves as a junior doctor to a patient, especially someone like a very senior registrar who is not yet a consultant but will be operating independently, leading clinics, doing all of these things? And no, they wouldn't, I don't think. A senior registrar particularly would never introduce themselves as a junior doctor. In my own experience, I've never seen a registrar of any description introduce themselves to a patient as a junior doctor, yet they are junior doctors. So all I think that we're achieving by introducing ourselves as junior doctors under those circumstances is introducing an element of, I am one of the more inexperienced members of the ward team that is seeing you today, and I'm not really sure that that's necessarily a good thing. It hides absolutely nothing. For me to introduce myself as, hi, I'm Ollie, or I'm Dr. Burton, one of the ward doctors working with the consultant, Dr. Smith, I'll be looking after you today. I think the most important thing, as ever, is not overstepping your boundaries, escalating appropriately, and do whatever it takes to keep patients safe, as we do all the time. And of course, the moment a patient does ask more specifically about your role, or something goes even a step over what I'm able to manage and answer confidently and safely by myself, then it gets escalated, and that's when you say, I'm not a specialist, I'm not a registrar, let me escalate that to someone who can answer it for you. But just to move forward and close things out, I really don't think that we're achieving anything by continuing to use the phrase junior doctors, because at the moment it is very much being used against us, often by people that simply don't understand the breadth of what it means. And I realise that there is a lot of socio-historical culture and context attached to the title, but really, I think we're approaching the point where it needs to stop. So this is the challenge that I'm going to give you all. Medical students, when you graduate, when you qualify and you start work as a foundation doctor, that's what you are. You're not a junior doctor, you're a foundation doctor. You're a doctor. My fellow foundation doctors, core trainees, all the SHOs, we are doctors, we are not the ward juniors, we are the ward doctors. And then as a polite plea to my SAS doctors, my registrars, my consultant colleagues, firstly, please do not introduce the foundation doctors and SHOs as the ward juniors. And secondly, please don't detitle us without permission in front of patients. All of us have exactly the same right to the honorary title as each other because it comes with the primary degree, not any further qualification. And one of the markers of my best foundation post thus far when I was working in neurology was that all of the senior doctors introduced us, the ward doctors, as doctor to patients when we were meeting them for the first time, so that expectations get set, and they never detitled us without permission. Obviously, it is completely up to you what you want to be called in front of patients. If I make it clear that I want to be called Dr. Ollie or just Ollie to patients on the ward, then that's fine, but that is up to me as a doctor to decide. Just as I would never ever introduce a more senior doctor than me by their first name to a patient. That's not the way things are done, but that needs to go both ways. So as far as I'm concerned, it stops today. You won't, or shouldn't, hear the phrase again on this channel, and that is a challenge that I leave you with. See if you can remove it from your vernacular, stop using it, and it might just go some way towards getting a bit of esteem back into a profession which has been stepped on for a very, very long time. Thank you very much, guys. Let me know what you think. This will be an interesting and charged debate, I'm sure. Take care, and I'll see you next time.